Oh, okay, folks. Welcome to the M&M YouTube channel. This is your Uncle Walter, everybody's uncle. Um, August 24, 2024, we had the M&M Helping Hand in the foundation. We had the fundraiser. Again, my Liberian people that believe in me and trust in me appeared there again. And they did the best. It was good. It was very wonderful. We had a good turnout for a very short notice. That program was playing in less than 1 month, and people did show up. Thank you again. And for you who haven't, contributed, donated to the M&M Helping Hand or Foundation, we will give the link out there on our next show so that you can be able to do that. It's also in the receipt when the guys go to pick up. Okay. But I have someone here that is that been a good supporter of ours, that been our backbone, that when we say, hey, I mean, we're doing this, he tell me what time can I make it there. He's a busy guy. His wife is a busy one. In fact, the man wife just became a doctor, just so you say, but I don't know what to tell you. Okay. And they have very successful businesses in the U.S. and also they're moving it to Liberia. He's no other than you are seeing him. You have heard me mention him. He's no other than Mr. Clarence Tweh. Mr. Tweh, welcome.
Thank you for having me.
Yes. Okay. Clarence, you have a lot. I've visited your businesses here. I visited your home here. You have a model that I really admire. I think a model that even beat most of the businesses that I see here. And you have been very successful in it. Now, I also heard that you're trying, not I heard, because I ship some of the equipment, that you guys are trying to build a hospital in Liberia, right?
In Carisburg.
In Carisburg. So can you please tell us a little bit more about what the project is?
So this project was birthed back in, thanks for having me.
Yeah.
This project was birthed back in 2016 when my wife and I went to Liberia. The goal was to, do the typical thing like most Liberians do who've lived here for many, many years. And I've lived here for so many years. The goal was to go to Liberia, find a nice piece of land, build our dream home in Liberia, and at some point retire home. That was the ultimate goal. Given that we're both in healthcare, my wife was a nurse at the time, and I still am an administrator, a healthcare administrator. We were curious about the healthcare system in Liberia, so we decided to do a tour. And we talked to a friend of ours who talked to another friend who is a doctor at GFK, and she agreed to give us the biggest of them all in Liberia, is GFK when it comes to healthcare and comes to hospitals. So we went to GFK and we did the tour. We went to other hospitals and did the tours there, but GFK was the turning point for us. We got to JFK. One of the things she said, one of the first things the doctor said was that you guys are here on the future list. So please, I want to keep my job. So you can't say anything, you can't do anything, just observe. And that's what pretty much we were there to do. So we get there and we're observing. We're doing nothing. But my wife is a caring person by nature. She's an RN. By the time,
Yeah.
Yes. And so we get in and we went through the pediatrics ward. We get into the pediatric ward. There was this lady just crying. She has the baby in her arm, and she's just crying. And the baby almost looked lifeless. And so instinctively, the doctor walks in front, passes, and instinctively my wife goes over to the baby and touches the baby's face, forehead. The baby is burning with fever.
Wow.
So, by the time the lady turned around, so the lady started to come back, waving to her, let's go. And my wife just, turned to the lady and turned to them. They said, how long have you been here? She hasn't been saying nothing. She's still sitting there with the baby. It's just frustration on her face. The mom, that is. And my wife was like, well, we got to keep him, we got to try to break this fever. And I think she had them use some room temperature water to try to break it down. She told them not to use very cold water because she don't want to have a reoccurrence of the fever, a bounce back of the fever, which is a side effect of use too cold water to break down the temperature. But anyways, we left that. We went. As we walked through, we passed near. That's the funniest part. I mean, it was not funny, but it's kind of funny. We passed right next to the lavatory.
Okay.
I kid you not. The guys were sitting in the laboratory. They were eating cassava leaf on the table,
Wow.
and the door was open. And I'm looking at these guys in the lab coat and the lab messed up and all that, eating cassava leaf. What? But we didn't say anything. We didn't say anything. We just said hi.
Yes.
But the climax was, and that was what took the cake. The climax was we get into the peds area where the kids were, and there were two kids. This was a big incident that kind of carried us into this whole hospital deal. So there were two kids there. They were both on oxygen. There was one oxygen tank, and it came out of the tank. The tube came out of the tank, and it split. One of them they both had tube in their nose, nostrils. But one of the kids obviously needed the oxygen from the oxygen tank. Unfortunately, the other kid did not need it.
But he was on it.
But he was on it. So this kid is going, and the nurse is sitting down there, like a few feet away.
Wow.
And my wife looks at him. She says, "What?" So, but then the doctor is there trying to say, "No, don't do anything. So my wife said, "No, I can't pass. I can't.
Yes.
This is not okay."
Yeah.
And then she said to me, "This kid needs the oxygen tank, the oxygen, obviously, but this other kid doesn't."
Wow.
And they ended up. Long story short, they came. Your typical thing. But eventually, the nurse manager comes over, and I kid you not, she puts her hand in her pocket, pull one gloves up because she wanted to check the kids' oxygen levels. So she takes one, not a pair of gloves, one glove out, hands it to the other nurse to check the kid's oxygen level.
Wow.
I'm gonna take the kid,
Wow.
puts it on, and she checks it, and for sure, the kid didn't need the oxygen. So they took the other kid off it. I mean, it was 2 hours, and then we went into the liver and delivery. We did all that stuff. It was just, but long story short, again, we get out. As soon as we walk out of JFK, my wife just kind of squat right there. She started crying.
Wow.
I mean, it was sad. It was so sad. It was so sad. And it's unfortunate.
Yeah.
And this was 2016, November, December 2016. We came back, and we're in the healthcare field, and we have friends who are in the healthcare field. So we thought we could have an impact. Where we would have the most impact, we felt, was giving back is to give back through the healthcare system. So how do we impact the healthcare system for the good, for the better? One of the things we decided to do is, okay, let's try to create a system.
Yeah.
And that was my master's in systems design development. But as we got together, we figured, the both of us can't do it all. We can't do all of it. It's a magnanimous task.
Yeah.
So we decided to talk to a couple of friends of ours. And I went to Cathedral right away.
Okay.
And two of my friends from Cathedral, one of them is a doctor, and his wife is a nurse. And she's always been a nurse manager for the most part of her professional career. And so they're well seasoned, well experienced. They both are. They currently live in Georgia at the time. Dr. Sam, currently rather, Dr. Sam Collet, who's one of our partners, and Aston, his wife, Aston Collet.
I dealt with her.
Yes,
Yeah.
he dealt with Aston. Yes. So we all decided. We talked about it, and we talked to a couple of other people, but they were more receptive of what we were trying to do. They saw the vision, and they trust us. We're really, really good family friends, and we decided to go into it with us. And we've been working on this since 2017. We had some challenges with the previous government. They wanted to know who were our supporters, who was paying the money for all of these things.
Like, you don't have your own, right?
Yeah, and I tell you, we're just Liberians who had reached certain peak in our careers, and we have these experiences and connections, and we can make this happen. We can do this. One reason or another, they just kept insisting we must provide, the nonprofit organization that was supporting us. But long story short, again, it didn't go anywhere because my board decided we're just gonna just leave it. There were so much challenges with the previous government, so we decided to stop. But this time around, there's more reception from the current government, current administration, and we think it's a time. And the board ratified recently and agreed that we should go ahead and go ahead with the construction of the hospital. So the hospital is set to We're set to start construction of the hospital in January, February. So everything are being in place, and we're working with all of they're working through all of the modalities to make sure it comes to fruition. So that's where we are with that, and it is our long term, both short and long term goal is to, again, that we initially started, to have some positive impact on the healthcare system in Liberia. Anyone who's in healthcare, or even not in healthcare, but have had some kind of experience with the healthcare system in Liberia, has some kind of concerns, have some concerns about it. So this is what we have done all of our lives. Collectively, we have over a century worth of experience just in America, as professionals. And so we want to be able to use that opportunity, use those experiences to give back, to help our people. It is a private for-profit organization, but more importantly, we will be working with nonprofit organizations and some other hospitals. Again, the goal is to build a healthcare system, a robust, positive system that will work more efficiently, and that's the ultimate goal of Cincinnati healthcare systems.
Okay. And just to add to that, for a lot of you that possibly don't know, when they got back, that's when he actually started collecting medical things. And like I've said, most of my videos, the first set of medical equipment that was ever donated to us was through the Schneider healthcare system. They actually gave it for us. In fact, right now I'm begging him for 10 modern hospital beds. So and it's good that he said the government is actually being really receptive of these program. We're going to carry it to a hospital. We can't keep refusing the modern bed when they give it to us because there is no current. There is no current. So we're still just asking for the crank bed. But the hospital in Dusa, we're trying to give them at least 9 to 10 of those modern beds. There was a lot of gowns and stuff in one of our donations. I've seen, apart from what you have explained, one of my trips to Liberia, I went to JFK and I experienced something similar like that, where one of a motorcycle accident. So, I mean, the guy was really bleeding and he kept crying, "Hey, my friend, please help me." Because he saw me pass through, I don't know if he felt I could really help him. Okay, but he just kept calling. "Can you please help me, my friend? Can you please help me, my friend?" You were talking about 2016. I'm talking about June when I first went to Liberia during Taylor time.
Wow.
Yeah. So, one thing that I'm happy for, Clarence, is that Liberians are now wanting to help. Liberians want to build homes in Liberia. Liberia, before then, who would tell someone to build a home in Nima? Now, Liberians are going building home there. And back to where we were talking before we get off track. I've seen your work here. I've seen your heart here. I know you very well. I watch videos and I edited them raw. So when I say things, I just say it. Your system here is organized. It works perfect. I've seen your managers and stuff. Now, one thing that I hear a lot from some of my customers, and I hope you guys will solve this problem. "Oh, Walter, I couldn't pay you this time because I had to send my child to Ghana. They're really sick, and that's the only place they can get good treatment for." Do you guys think by any chance, with what you have here, comparing Liberia and America is not a very fair comparison? But what can you guys think you guys would be able to at least bridge that thing where they can have medication from the US, where for something as common as what someone will go to Ghana for treatment, you guys think you guys will get to that point?
Oh, totally, totally.
Okay.
To answer that question, I'll kind of go back a little bit. I was born and raised in West Spring. I always tell people good things do come from West Spring.
Wow.
Believe it or not. I went to Cathedral. But I bring that up to say that, I'm a Liberian by heart. And we know I left the war. I was 16 years old when I left the war in Liberia in the middle of the war. And you're right. There is a breach that needs to be mended, with respect to expertise and services, and how people look at services. Um, I came on this side after high school, went to Cathedral, and I went to University of St. Thomas when I'm going to graduate my graduate school, all that fun stuff. I never worked. I actually worked in Liberia for a paycheck.
Yep, neither me.
As a
Yeah.
teenager. So there are some habits, some things that guys who had the opportunity to go to LU, work in Liberia. There are some habits. I'm not going to say bad habits, but there are some ways of workings there that I don't know. I just don't. I can't comprehend it. I'm sorry, I just can't. And
Oh, what country
the way I know
that?
how to do it, is work in a system. And and I do think though Liberians can work in systems. We come here to America, we work in systems. I run a company with over 90 employees. They work in a system.
Yeah,
Trust me.
yeah.
I
I've been
built a
there.
system.
I've seen
They
it.
work
Yeah,
in the system. They can.
I can
And they do.
testify.
Yeah.
Yeah.
They work in the system. So it's not that Liberians can't do this, can't do that. We're brilliant people.
Oh,
We
yes.
can do these all of these things we see all around you. We can do it.
Exactly.
And it's just a matter of us having the willpower and wanting to get it done. So the short version to that is that yes, it is possible. Yes, for Snyder Healthcare, I can attest to that. I'm the president and chief executive officer for the project, and I will be the administrator for as long as I am there. We will have a system, and we will work within everyone, including myself.
Thank
We'll
you.
work within that system. And I think every Liberian that come through the doors into our hospital and go through that, we will go through that system. It will not be some kind of, exit out or just it's not going to be a business as usual in Liberia. I go to
Right.
Liberia very frequently.
Oh, yes.
And I see
Basically,
that-
bi-weekly.
and I see how they do business at times there, and it just completely baffles my mind. But yes, I think that that works better. The system works better, and that we know no other way.
Okay.
That's how.
And I will tell you something about the system. Now, normally when you come here, you don't see my warehouse as packed as it used to be once upon a time. But business is moving. I met a guy in Restaurant Depot. And we have a restaurant that, so not with Restaurant Depot to buy from. Of course, the things that we ship, we don't buy from Restaurant Depot, we get it directly from the supplier. And I met this guy there and I asked him, and I said, hey, you know that I have rice, right? He said, yeah, but do you have the 50 pound? And I said, yeah, I do. And then I said, but because he bought beans from me, but then our price was different, and I don't price match my beans because my beans is made special for M&M. So, and then he said to me, he said, Walter, once it comes to supporting Liberia, I will always support you. But let me tell you with your warehouse why we have the problem. You have a system. And a lot of us don't want to work with the system. And this is an Liberian right here in America. And I respect him for that fairness. He said, that's the only thing you have. You have a system. And we can work with that system. Yeah, and I was like, wow. But at least it was fair enough. I gave you, before you load my wire, I gave you 3 days. You have to bring all your things here in 3 days. When we're loading the container, you bring it here. You put it in the container yourself. You do not bring cars here and drop it off and tell me I'm going to come back tomorrow. No, I will tow it. And Liberians know me for that. Okay? Because there is a system. And, just that, like he said it, and look, I've been to his areas. I've been to his business. I took a tour there. This guy was one guy that I met, and my thought for business actually changed. So, again, like he said, it's not a non-profit hospital, but it's going to be a hospital that's going to be worth every penny that you put there. Because, like I said, I've seen what he does. He do give back to the community. So this is one thing that I will let you guys know. There is an orphanage around the area that they do help with. We're working on some stuff. It's not in fulfillment yet. So as it goes on, we'll always let you guys know. But apart from that, he is a humanitarian. This guy have supported us in so many ways. So when he says that there will be a system, trust me, there will be a system. And once they get started and everything, we will put that link on the website too, also with the M&M. They're going to, have, they're going to have some payment things where most of the families here can do their payments here, because a lot of the support from Liberia even from the people that buy from me, about 60% are done yet.
Yeah.
Or more.
And most of I'm trying to cut you off, but not most of, all of our medications are going to be coming from the US. They're going to be FDA approved medication. We're working with a Liberian pharmacist who's licensed in the state of Minnesota, a couple of other states too, Dr. Marshall. And he has the dealership license to buy directly from the manufacturer. So and he's working, he's part of the team, the Scenario Healthcare Systems team, and he will be, be the one in charge of all of that whole portion that drug,
Okay.
bringing drugs into the country, making sure they are not expired, making sure that we have the right medications. And so as people get the prescriptions, we are also working with another company. The deals haven't been finalized, so I'm not going to call the name yet, but where like Walter is saying, you can buy your prescription, pay for your families can pay for the prescriptions here, and then you can pay for the prescription here, and the family can receive them back in Liberia from any of our many facilities, and
Okay.
you will have access to the medical records to make sure that your family is okay. That the money you're paying for them, to go to get treated is what they're being treated for. And I think that sometimes we talk about HIPAA and all that fun stuff, and I live in HIPAA world. Believe me, I know it. But it's for like in Liberia, and it should apply in Liberia. Don't get me wrong.
They do. Everything
Yeah,
that's here is on the book in
yes,
Liberia.
exactly.
What is they executed is a problem.
Yeah,
Yeah.
but the whole idea is for individuals here who supporting your mother in Liberia, making sure they want to make sure that her health and well being are being looked after. My mother lives here with me. I get her paperwork as far as HIPAA is concerned. She signed that right over to me to be able to get her paperwork to read it and know exactly what's happening to her, what's going on with her. That would be kind of how that system would work in Liberia. That's the only real way we know how to work. Like I said, we have over a century worth of experience amongst the four of us, four key partners, and that's how we will work, and that's how it will work.
Okay, and just before we wrap up, he did mention a Liberian pharmacist's name, Dr. Marshall. Yep. I don't know if you know this. I used to get my medication from CVS. When I got to know the day we all met that you guys are talking about Marshall, now Marshall is our pharmacist now. So all of the same medication, the medication that I get now, I get it directly from him now. Okay. He's able, if there is any deal on the medication, I am notified. I am going to have him on here. It's a brother that I'm very proud of. I saw, in fact, the first time that someone told me he was a doctor, I laughed because I met him at one or two places, okay? But very down to earth guy. Yeah, very down to earth guy. So I'm going to have him here. I know this video went a little over the time I expected, but I'm going to split it into two because this is very important for people to hear. We have to support each other. Like I said, now, he doesn't have to do some of the things he's doing. I'm telling you, this guy is fine in the US. He's 100% fine. He doesn't need to take one step on the plane to say he want to do something like Liberia. I'm telling you, I'm a witness to it. But for people who are giving that kind of sacrifice, to the country, my people, we support him the best way we can. That hospital, we pray for it to pick up. He is right. I know from 2016, they've been fighting this to get it up. Thank God to the new administration for accepting it. We're not politicians. It just happened in this town, so I'm talking about it. Okay? But Clarence, before we wrap up here with this thing, like I said, I'm going to divide this and hopefully I can have that here. I did learn one thing in life. Even though you go Liberia all the time and you get this, during the last program, we were actually intending on just honoring or recognizing just two people, and the two people were trying to honor and recognize in our community, and for the MM helping hand were actually Don Martin and then Tom, which is Nwale's husband. But they were in Arizona at the program, so they couldn't come here. But my staff said, man, I know you want to honor Clarence next year when you want to honor other people, The reason I choose those two guys because they're different from us.
Yeah.
They're Caucasians, you know, and they're willing to help us.
Yeah.
But you have not stopped yourself. You know, if they take one step, you take two steps. You know, and so we just could not. I know what's in there. I wish it was money that was full in this thing, but unfortunately, it's not. It's something that you can go Liberia over and over and just grab and bring. Don Martin did open his. You can take it with you, but it's just our way of saying we appreciate everything that you do for the community, for us, all of the help that you gave us and continue to give. In fact, when we tally up whatever that we collected, he's promising to match that by 10%. My people, this is our own. And I say it over and over. We're used to praising other people. We're now to the point now that we're going to start praising our own. After this program, we're trying to work together. I will have Clarence here again, or at least 10 other people that do business, so that we can have a chat. But Liberians, look, if you guys support us more, imagine what we would do back home. Okay? You guys have to. Yeah. Let's make it a must in 2025. Okay? We're going to have a program sometime in 2025. We're going to send that invitation all long enough. I'm going to make sure that Clarence and everybody that we have on this show come there. We cannot always be the underdog. We have people that have the willingness. We shouldn't make their willingness go to vain. What they're trying to build in Liberia, there is another part of their project. We're going to skip this to another time. Something that you're going to need to hear. For all the houses we build in Liberia, I ship the machine. So there will be a part 3 to this. So once again, Clarence, thank you for joining us today.
The pleasure was mine.
Yeah, and this is your Uncle Walter, everybody's uncle. So we'll see you next time. Thank you.